As a parent, you worry about their health, sleeping schedules, and what they're having for lunch. But what about those tiny teeth? It might look like a mystery box with confusing advices. What if I told you cavities are contagious, or those tiny little gaps between the baby teeth are actually a great sign? Today, I'm going to unlock that mystery box. I'm going to share 7 critical things that most parents wish they had known sooner about their child's teeth. And trust me, number 4 and number 7 are game changers. Let's get started. First up, the biggest myth of all, baby teeth don't matter. Why? It's going to fall anyway. But this is so wrong. Think of them as a perfect little space savers. Each baby tooth holds the exact spot for the permanent teeth, which will come in later. Now, if a child loses a baby teeth due to decay, then other teeth will drift into this empty space. Now, it's like a traffic jam in the mouth, often leading to crowding of the teeth and need for the braces down the road. So, what's the takeaway? Treat the baby teeth exactly with same care and urgency that you would with permanent teeth. This one surprises most of the parents. You don't have to wait for the teeth to come out to start oral hygiene. The same sugary residues from milk or the formulas can build up on the gums. To clean, take a clean wet cloth or a gauze and wipe the baby's gum. This will clean the mouth as well as get them used to the feeling, making switch to toothbrush later so much easier. Most of us wait until our kids are 2 or 3 years old or until we see a problem, but the official recommendation is to see the dentist by their first birthday. Now, this first happy visit isn't about drilling and filling, it's about you. The dentist will spot the early warning signs and teach you the best way to brush and also answer all your questions. Plus, it establishes the dentist office as a safe place and a normal place from the very beginning. So, what's the takeaway? When you're planning the first birthday, book that first dental visit too. Okay, get ready for this. You may not catch a cavity like you catch a cold, but the bacteria that causes cavities are absolutely transmissible. These bacteria can pass down through saliva. Now, when you share a spoon or finish off those leftover yogurts or clean your dropped pacifier with your own mouth, then you might be giving a dose of cavity causing bacteria to your child. This takeaway is huge. Your oral health impacts your child's health. Hence, it is very important that you take care of your own oral health. We all know the bag of gummy bears are unhealthy, but what about those crackers and granola bars and even milk? Here's the deal. Every time your child eats or drinks anything sugary or starchy, the bacteria in their mouth produce acid, and this acid attacks their teeth for almost 20 minutes. So if your child is grazing on that crackers all day long or keep sipping from the sipper bottles any juice or milk, then the teeth is under constant attack from the acid with no time to recover. So what's the takeaway? Consolidate those meals and snack for a set times. In between, water is your best friend. Do you ever look into your toddler's gappy smile and worry how their adult teeth will look like? Don't. These gaps are fantastic sign. Permanent teeth are way bigger than the milk teeth. So these gaps are nature's way of saving room for the bigger guys to come in straight. So if you see the gap, don't worry, because very well defined baby teeth are a warning sign for the crowding teeth later. So the takeaway, embrace the gaps. They're the sign of good things to come. And finally, that secret teeth that show up without any warning sign. At around age of 6, you're looking into the front wiggly teeth, but a major event is happening in the back side of their mouth. Their first permanent molar, or also called 6-year molar, erupt in the back side of the mouth. These teeth don't replace any milk teeth. They just sneak in. because of which they are most oftenly mistaken as built teeth, and parents don't realize how important they are. They have deep grooves, and kids usually find it difficult to reach there, often becoming a magnet towards the cavities causing bacteria. So what is the takeaway? Around 6, be a detective. Look way back into their mouth for these new arrivals and ask your dentist about dental sealants. These are the protective coating that is done to prevent cavities. And there you are, 7 important things that can make a huge difference in your child's dental health. So let's do a quick recap. 1, baby teeth are very important, critical placeholders. 2, start cleaning their gums even before their teeth erupts. 3, their first dental visit should be by age 1. 4, the cavities are contagious. 5, constant snacking is as bad as candy. 6, the gap in between their teeth are a healthy sign. And finally, the 7th one, watch out for those sneaky little permanent molar. Which one of these has surprised you? Let me know in the comments below. I'd love to hear from you. If this video has helped you, give it a thumbs up and subscribe for more parental advices like these, which will make our life a bit more easier. Thank you for watching, and remember, you got this.